Hello everyone and welcome to this audio podcast. This audio podcast as part of a ZtormLabostix article. This audio podcast is part of a Bellow and Raw. This audio podcast is part of a Chrome edition. This audio podcast as part of a ZtormLabostix production. Now looking at the history and examination, around myasthenia. One of the questions in around part of part of the history from medics in around myasthenia again is to understand what has the patient recipient or other people have noticed. When is the weakness most marked, and after activity towards the end of the day, and is there fatigue? Has there been double vision? Are there or is there problems with speech, swallowing, or breathing? Is there any history of other autoimmune conditions? Is there any history of thymoma or thymectomy? In around the examination around myasthenia is where sort of medics and clinicians, for example, to understand it, to get an understanding in around is there any muscular weakness, to examine after repetitive movements, for example, looking at shoulder abduction, examination around eye movement, so looking for ptosis, diplopia, and sort of other abnormal eye movements, examining prolonged upgaze, prolongation of upgaze or upgazing, is to understand whether to understand is the patient or recipient speech normal, or is there a weakening with prolonged or slurred speech, and when medics and clinicians in amongst sort of textbooks have patients or recipients with myasthenia, or suspecting of myasthenia, or suspecting of myasthenia gravis, to ask recipients or patients to count up to 100. If there is any suggestion of the respiratory symptoms or weakness, to assess the respiratory function with spirometry and arterial blood gases, and to also look at sort of whether there's fatigue on chewing, and where the masseter can be affected, on what is referred as mastication. That draws this podcast to a close. This audio podcast is part of a Bellow and Raw. This audio podcast is part of a Chrome edition, and this audio podcast as part of a ZtormLabostix production.